Okay, back to toxicology. Let's go over a few more nitrates. So that's another common drug that we see, and these are not necessarily the nitrates that they're prescribed with. These are like your fertilizers, and so these cause hypotension, as most nitrates would, and then they also cause some methemoglobin cyanosis and respiratory difficulty. There's an antidote for this. The antidote for this is methylene blue. Again, this is stuff that we're talking about as far as fertilizers. This is not necessarily the nitrates that you put sublingual for ACS or cardiac issues. The next one would fall under industrial chemicals, would be organophosphates. These are poisons or pesticides. Very restricted pesticides now. So there's a lot of laws that inhibit these organophosphates from being used. However, it doesn't necessarily mean that they're not being brought in from other countries that allow it to be used. So this gives you the sludge criteria. And remember, these would be the reverse. These would be like cholinergic effects. So again, this is opposite of atropine. This is cholinergic, not anticholinergic. So just reverse some of these symptoms. When you think about it, organophosphate is anti-atropine, and we have sludge or sludgeum. And so what we would give for cholinergic overdose or organophosphate would be, we'd give the atropine. So atropine and 2-PAM chloride would be our chemical antidotes for this. So review that sludgeum as you go through that. One of the last one is an industrial solvent called methylene chloride. It's used to convert carbon monoxide, and it converts carbon monoxide into the body. And so we're going to treat that as we were for carbon monoxide, which would get them out, high flow oxygen. And what we need to do is just perfuse the body with oxygen. So the best treatment of joint is high flow oxygen. Reduce the chemical load on them, wash that stuff off if it's absorbed, and then basically it's try to get more oxygen into the body. And the best way to do that is hyperbaric, other than just 100% oxygen, having them breathe that in and removing them from the vent. So carbon monoxide, product of combustion. A lot of times now our cars have a catalytic converter, so we have less of that toxin being extruded out into the environment. So we have less chance of that poisoning or lethality, intoxication, or patients becoming succumb to that. But now when we look at people that heat their homes, they may use some type of combustible liquid, oil, or fuel to heat their homes, and this will lead into that non-smelling, clear type gas that causes the red blood cell not to release or actually pick up the oxygen that it's supposed to pick up. So you get this really pale, or not pale, opposite of pale, is memory cherry-like and pink-looking color to their skin. They may complain of headache, become stuporous, tachycardia, and coma and death. We want to remove them from the environment, make sure that they have adequate ventilation, and we want to give them 100% oxygen. That would be the case. There are some other chemicals, household chemicals. There's even stuff like cyanide. These are all other things, like we thought maybe like mushrooms, different plants that may be used. These psychedelic plants now, and then even to the point where like marijuana or the angel's trumpet, all of these plants and things that you're gonna have to come into some idea of what was ingested, what was taken, again, how long it was taken, and how much was taken, and when it was taken. And to communicate that, because there's not a lot of antidotes that we carry out there. Again, we're going to review some of the antidotes real quickly. So for a Tylenol or a acetaminophen antidote, we are looking to give it's mucomyst or acetylcysteine. Then we're looking at maybe a narcotic overdose. Narcotic overdose, maybe over heroin or a morphine-like product or opiate. What was our antidote? All right, so it's Narcan. Follow your local protocols for administration route, and then the max doses that you give. Remember that if they're on something that's chronic use, that they may end up going into acute withdrawal syndrome or withdrawal symptoms. Okay, the next one would be some type of benzodiazepine. Benzodiazepine, which is a term would be some kind of Valium or midazolam, lorazepam, those kind of anxiolytics. And that's very rarely used for anything other than some kind of anxiety issue. And now we were given an antidote would be think about it, what's the antidote for benzodiazepine? Romazicon or flamazanil. All right. So tricyclic antidepressants and potentially other meds such as aspirin or NSAIDs. We don't necessarily have an antidote, but we might try to do a few things. We want to bind the material, which would give something, and we want to try to alkaline the urine so that we get more excretion of it. So think about that. As they come down to insecticides or more of your cholinergic response to pesticides, these cause cholinergic response. We get the sludgium. What would be our antidote? It's the purple box. It's the anticholinergic. We have atropine and 2-PAM chloride. 2-PAM chloride kinds of binds. Atropine tries to reopen up the receptor sites to allow that cholinergic response. Carbon monoxide. That is a byproduct of combustion. And so they turn kind of a cherry red. It decreases the red blood cells' ability to absorb and to take in oxygen. It actively competes for it. And so what is their treatment? Move them from there, give them high flow oxygen. And there are a few other ones that we want to try to at least give some kind of hyperbaric treatment. Now there are other agents like cyanide and chlorine gas and and nitrates. So I'm sorry, I forgot about the nitrates. So nitrates, this is your fertilizers, sometimes commonly used in the recreation of the terrorists. They like to combine this and add a fuel source and oxidizer, and then they have this deadly thing. Now, if the fertilizers overabundance, it absorbs through the skin. Maybe they ingest it on their hands because they haven't washed it. They end up becoming intoxicated, or the toxins overwhelm them. Antidote for that is methylene blue. So I'm gonna assume that you're gonna review some of your toxicology and toxidromes, giving you the signs and symptoms and the antidotes for those, because again, these are some of the common meds and some common drugs or common toxins that your preceptors, mentors, and evaluators, and who knows, are just going to try to pimp you and see what do you know it, and we'll continue in a short view.